Sometimes the individual will just have an underpad on the bed or in their wheelchair. This is a small disposable underpad, a softer material that's next to the patient, and an impermeable backing that's made out of plastic. This is a small one. This is the same kind of underpad, about the same size, but is a reusable one, made out of cotton on the interior and something that prevents moisture from leaking through on the other side. This is also an incontinence pad. This is not disposable either, but is a reusable one, and you can just see that it's quite a bit larger. This is also used sometimes as a lifter sheet for helping lift the individual up in the bed. It's important to maintain a positive attitude when changing soiled garments and linens, to communicate acceptance of the individual regardless of what's happening with their continence or incontinence. Change wet clothing and linens promptly. Keep the skin clean and dry, and use barrier creams if necessary to protect the skin. Urine and stool both have strong toxic chemicals in them that will cause skin breakdown if it's left on the skin too long. So it's important to get them removed as quickly as possible, and barrier creams. I have some examples of barrier creams here. Some are a white, thick cream that is not water soluble, and some come in a spray as well, and some are cotton-tipped applicators, all for the same purpose of providing a barrier so that urine and stool do not cause skin breakdown. Keep pads and clothing wrinkle-free so that, again, there is no damage to the skin. Now I'd like you to watch a demonstration of changing an incontinence brief. Changing an incontinence brief. Wash your hands and obtain needed supplies. Apply your gloves. Fan fold the top linens to the foot of the bed. Cover the patient with a bath blanket. Loosen the brief tabs and fold the brief between the thighs. Wash, rinse, and dry the perineal area thoroughly. Apply barrier cream if needed. Assist the patient to lift or turn onto their side. Remove the soiled brief and place in a disposable plastic bag. Clean and dry the rectal area thoroughly. Apply barrier cream if indicated. Apply a clean incontinence brief according to the product directions. Arrange clothing and replace any that are soiled. Remove your gloves and dispose of the soiled brief in the plastic bag or per facility policy. Wash your hands. Report and record any observations.